At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Seeing Beyond the Surface with Thermography on Wednesday, September 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live, as you do every Sunday at high noon on WMAL 105.9 FM right here in the nation's capital. You know, you let me go away for 3-4 days and kind of see what's new in the natural healthcare industry. I come back with all kinds of crazy in my head, but things that I want to share with you. I left on Thursday morning and I went to Orlando, Florida. And I went to the Hyatt Regency. Somebody said, yeah, you know, he was in Orlando. He went to Disney. He didn't go anyplace else. Well, I didn't. I went to the Hyatt Regency and I only saw the outside of that hotel once for about 10, 15 minutes. And the rest of the time I was inside. But there was 3,500 people. It's called the National Convention. It's sponsored by the Florida Chiropractic Association. And there were 400 vendors and things like that. So, you know, when I go to something like that, I come back with like 10,000 ideas in my head and things that I want to share with you. And so there was a guy that was there who I've met a couple of times over the years, and interesting man. His name is Ben Greenfield, and he does all kinds of applications and biohack, and you know, showing you how to optimize certain things and so forth. I'm sitting there and I'm laughing at him because he started talking about a substance that you can use that is the best facial treatment and conditioner that there is. I'm going to talk to you about that. So you got to stay tuned. You can't leave me. And I will tell you that before we get to the end of the program and actually how to use it. And you're going to look at me and say, oh, of course, that's what you're going to say, right? Well, yeah, actually I am. But we want to talk about a lot of different pieces of the puzzle. One of the things I want to remind you of is that coming up on the 17th of September, in a very few weeks, we're going to be doing an in-house presentation at the Roselle Center for Healing on seeing beyond the surface with thermographic imaging. Dareth Painter, who many of you know, who's amazing when it comes to taking pictures, and she has a host of about 15 physicians that read these things day in and day out. But if you've been listening to the programs, you've been listening to me on live stream, what thermography is non-invasive, non-radiation, no side effects. It measures heat signaling from the body. So, for example, ladies, if you're developing a breast tumor that, oh my God, could turn into cancer, that breast tumor has to develop a blood supply first. And that blood supply is what's recognizable on thermographic imaging. So you're taking a picture of heat, sensations, and changes. Now, the blood supply that is vascular, we'll call it a vascular bed, it portrays heat, and it shows up anywhere from 3 to 8 years. 3 to 8 years. I'm not missing what I want to say here. 3 to 8 years before the tumor actually shows up. Now, if that's the case, and you can begin to see the change in the shift of something like that early, now you can do something about it without chemotherapy, without surgery, without any of the invasive stuff. But in 100%, no, there's always the oddball out there that you have to do something. But we've seen this thousands of times over 49 years of practice, that if you know something's developing before it develops, then you can take proactive steps. So on 17 September, Wednesday night, 6 p.m. at the Roselle Center for Healing, join Dareth, and we're going to get into the intimacies of what this looks like. We're going to show you pictures. We're going to show you the camera. We're going to show you what it looks like. It's really 100% modern age. Did you know, by the way, ladies, that in Europe, the go-to for breast screening on an annual basis across the board, all professions, is thermography? Here we want to do what? We want to radiate. We want to take that soft breast tissue. We want to crush it with 45 pounds of weight. Then we want to radiate it. Don't you think that might cause some damage? I don't know about you, but the short answer is yeah, probably, right? So join us on the 17th. Register. You can go to rosellecare.com. You could go to drtomroselle.com, or do it the old-fashioned way, 703-698 7117, 703-698 7117. We'll get back into that just a little bit, but I want to talk about, what thermography actually shows. It's an imaging, a heat signaling picture that can reveal a wide range of conditions and physiological changes in the body, and things like neurological conditions, not just tumor formation. So regional pain syndromes, peripheral pain, peripheral neuropathies, it can show it exactly. It can show, how the distribution is. Nerve root irritation and compression. In my world, we call that subluxation. Yes, it can show that. Cardiovascular problems, including plaquing, arteriosclerosis, including deep vein thrombosis, the plaquing that occurs way down, particularly in your legs, and then goes someplace else, and you end up with a heart attack or stroke. Yep, it can show that as well. Musculoskeletal problems like, sprains and strains, but particularly inflammatory arthritis. Now, we talked about breast health. How about ocular, eyes, inflammatory reactions, detecting changes in temperature gradients that may indicate some very serious ocular patterns? It will show it. And it doesn't hurt your eyes to take a picture, but it will show it up. Thyroid dysfunction. How about those of you who've had, a thyroiditis? Thyroiditis means an inflammatory reaction. Thermography is an amazing tool for early detection of all kinds of health issues. It provides a non-invasive, it's painless. You don't get that breast crush. You don't have other parts of your body. You're not exposed to anything that's going to cause damage to your system and so forth. But wouldn't it be useful for identifying things before they became more severe? And particularly when other tests are inconclusive, that maybe it's, maybe not, maybe this, maybe the. So join us on the 17th. I promise you, we're going to get into the intimacy of this thing and really walk through it with you. And we're going to demonstrate it. We're going to show you what happens. If somebody's got let's say a bad facial pain, you've got a TMJ problem, it'll show it up. And, we use it in the practice because it can zero in on something that's developing. In the world of my practice and applied kinesiology, we can tell using muscle function response testing and so forth. But when it's coupled with something like this, or if you're not a patient of ours, by the way, you don't have to be a patient of the Roselle Center to take advantage of these types of things that we offer, because we actually have a separate company. It's called Thermography Centers of Fairfax. And you can look that up, thermographycentersoffairfax.com, and see what it looks like and look at some of the pictures that are there. And I think that you'll be impressed that this simple tool that's been around forever, that it's actually in most situations in the initial stages more accurate than any other type of diagnostic imaging when it comes to breast tissue. Why? Because it begins to show. So you should ask me the question. The question becomes, if that's the case, how accurate is it? Well, with mammographic examination, mammography has, and some people will tell you, up to 30% false positive, false negative rate. And that's pretty significant. You're doing all this stuff, exposing yourself to radiation, and it has that kind of, false positive, false negative. I don't think so, not for my body anyway, particularly when it adds X-ray radiation to my body. Thermography is less than 10% false positive, false negative. And so it detects disease processes by temperature gradient differentials. And that's what I want you to get out of this. Temperature difference radiation. Now, join us. I'm going to show it to you. We're going to take pictures. We're going to show you pictures. It's It's cool stuff. It really is. It's excellent. So be there with us on the 17th, and you're going to be impressed, truly, truly impressed. And all you got to do to be there with us is reserve your seat at where? rosellecare.com, ROSELLECARE.com. And by the way, if you want to know about thermographic services, perhaps way out, let's say you're down in Fredericksburg or you're way out someplace else. So if you're not close in, I mean, it's worth it. It's worth a trip, by the way. It's worth a trip. But we have a mobile unit that goes out and does a lot of that as well. So join us, and you'll learn a lot. It truly will. It's going to be interesting. Even Lyme symptoms will show up, and adrenal symptoms will show up. It's kind of cool. All right, let's get into a little bit more of what blew my mind over the last couple of days, and then we're going to end up telling you about this one skincare treatment, this biohack that most of you might, I've known about it, but most of you don't. And why am I bringing it up? Because obviously things get triggered when you attend these conferences, and I have to speak a little bit, but I'm listening to some brilliant, brilliant, brilliant people. But let's talk about artificial intelligence in healthcare. How many of you have gone to see a doctor recently, in the traditional sense, medical physician and, wherever, or going to the hospital, and you don't even see anybody anymore? You might see somebody that comes in, you don't know if they're a nurse, whether they're a support staff, whatever, and they come in with a computer and they start asking you questions and they're pumping into the computer, right? So all that is in today's world, and it's growing exponentially, is technology that supposedly is safe and ethical, and in my opinion, so nobody has to touch you anymore. See, I'm still the old-fashioned doctor that I want to hear your voice. I want to look at your skin. I even will go and put my nose in your elbow or your wrist, and I'll smell it because the skin gives off all kinds of different sensations, if you will, smells that you can't pick up any other way. But this AI, this artificial intelligence, the future of healthcare and AI it's like the good guy and the bad guy, but I'm beginning to wonder how good of a guy it is, because it's going to be controlled. They're talking about putting wearables on you. These wearables, they're like the watches, the things that we go out and spend money on now. These, they're hooked into the computer system. They tell you how much you're sleeping and gives your blood pressure and your, so forth. Well, these wearables also can feed back information to a central database, and that's how they're going to sell it to you, by the way. But think about this. If that's the case, it's not just one way. They can input to you as well. I don't know about the rest of you, but I'm old school, and I don't want anybody knowing everything about me. If I decide that I want to take care of my body, I want to be able to measure those things, but on my terms. I don't want to have somebody monitoring me on an ongoing basis. Now, you're saying, Dr. Tom, aren't you getting a little out of... No, I'm not, because this is what they were talking about. I listened for 2 hours. This one physician, he's a medical physician out of Tampa, and he's very much into the AI platform. And he's saying, listen, doctors, you're going to see within, and he said it's going to be less than 2 years, that the majority of healthcare is going to be about monitoring and getting a database that's extensive. And how they're going to sell it is they're going to have inputs coming from all over the place. But they're going to put the stuff in and they're going to hook you up, and they say, well, we're going to monitor it. So how are they going to monitor it? They're going to put these wearables on you, and you're going to have this constant information exchange, if you will. But, let your imagination stretch. Remember, this is my opinion relative to what's going to happen down the road. It's not my opinion relative that it's coming or not. It's coming, whether we want it or not. But you're going to be using robotics. I mean, you're going to have robots within a few short years that are going to be the assistants, and they're the ones that are going to be running these programs. You're going to see somebody pop up on a screen. Matter of fact, one of my patients was telling me the other day that there's a urology department at Nova Hospital that nobody's there anymore. And, somebody pops up on a screen, you go in, you get some certain blood work, the nurse practitioner, they're not even there. I don't know about you, but I got to put my hands on your acupuncture pulses. I want to see what your body looks like. I want to be able to test the muscle reactions. I want to know whether, where it's coming from. It's scary, I think. I think it is. And, if you go into Johns Hopkins University, and there's a platform that's online.lifelonglearning.jhu.edu. Did you get all that? And it's an AI in healthcare course. It's 10 weeks, online program in AI, mastering AI and ML techniques to analyze healthcare data and enhance clinical decision making. I just read to you what's going on. Now, it's not enhancing clinical decision making, it's going to make the decision for them. And for some guys out there, that's probably a good thing because they're brain dead. Did I say that? I didn't say that. Maybe that's a good crutch for them. But for those of us that really care, that give a blast about your health and so forth, and want to listen to you a little bit. And they were showing technology where all we have to do now is sit there and talk to you in the room, push a button, and everything's being recorded. Everything that you say, everything that I say, and it's all there. So you can't say he said, she said, they didn't say, no, I didn't, and so forth. But that's coming as well. And it's going to be across the board. And that's going to be mandatory, if you will, in what's called the EHR record keeping system. It's electronic health records, is what EHR stands for. I don't know. I'm sitting there. I went to my alma mater's open house, and this young man came up and he said, Doc, he said, when'd you graduate? And I told him. He says, wow. He said, you've been in practice that long? I said, yeah, it's been a journey. He said, how come you're still at it? I said, because there's too many goofballs like you that need to have some input put in by old people like me. And he said, what's the retirement plan? I said, when the good Lord decides to take me out of this plan and say, you're done. And he looked at me and we switched. We got into a long conversation, pretty bright kid. And we started talking about how things were going to be applied, even in the world of natural and integrative therapeutics, where you have to put your hands on people. And I'm listening to this young man, obviously a smart, intellectually smart young guy, but I'm saying, where did you park your human compassion? So I'm kind of dumping on all of you right now, because I walked away with, oh my God, is this what it's really coming to? But you better learn about it, and you better not have anybody tell you that is absolute. But you're going to read things like, robotics and how they're transforming healthcare, and then the billions and billions of dollars that have already been invested in artificial intelligence relative to healthcare, because they know that's the way it's going to come in. My opinion, you've heard me say this 1,000 times, all the garbage that we just went through with, COVID and so forth, that was kind of a test balloon in many cases. It proved a lot of stuff. What did it prove? It proved that so many of us are malleable, that can be directed, that can be controlled, that can be told what to do, when to do it, how to do it. And oh my God, the world's coming, the sky's falling, like Chicken Little, because that's what we really went through. So, yeah, you're listening to Dr. Tom tell you things from his own, backdoor imagination, his opinion, if you will. But I want you to think about it. I want you to think about how will artificial intelligence impact your healthcare and that of your family. I want you to think about, all the changes, the things that you've been forced upon you, from the transgender situation, all the way through to mandatory vaccines. Did you know there's 72 vaccines that are required if you follow the schedule? 72. And the greatest majority of them, well over 75%, have never been checked out for safety. Not once. Not once, other than a dog or a cat, or you're not a dog and you're not a cat. So think about what's coming down the pike. You become the rabbits, right? Well, let's get into something a little bit more fun than all of that. I know what's going on, but please join us on the 17th. Register. I'm going to be there. Love to meet you if I've never met you before. And we'll answer questions. We always extend a little longer. But I want you to meet Dareth Painter, because she's amazing. She has an intuitive sense. medically, but when it comes to thermographic imaging, they don't come much better. They really aren't. We get a chance this week. We're going to meet a guy by the name of Dr. Peter Leando. He's a medical physician. He's the one that created the company that Fairfax Thermography Centers work with. Now, having said that, let's talk about something that is an ingredient that goes into my culture, right? And it's used for moisturizing. It has tremendous anti-aging properties. It's used for wound healing. And you can even, use it to, protection against environmental radiation and damage. What am I talking about? Same thing Sophia Loren has used for years. We're calling about olive oil, good old-fashioned olive oil. Olive oil is a versatile skincare ingredient used for moisturizing. It's definitely anti-aging and has amazing healing properties. And it's beneficial for every type of skin out there. It's not one of these things, oh, you can't use it for this skin, you can't use it for that skin. But anti-aging properties, very much like your vitamin E, you've told them the polyphenols. Olive oil helps push away, combat, if you will, oxidative stress, where the tissue begins to destroy itself. And you know what that is? That's called your wrinkles. Those are the wrinkles. Those are the age spots. Those are those fine little lines that you want to get rid of. Wouldn't it be a whole lot cheaper? Go buy yourself fresh, organic, unfiltered olive oil, and then just put it on your skin, and it would improve the skin elasticity. See, I'm not even selling it, and I'm telling you how this stuff works. It's amazing, right? But olive oil is incredible. It's one of the most amazing things that you can possibly use to protect yourself. And, it's like, wow, right? This is crazy. It's good. It's good for you. So having said that, do I use olive oil? I can use a ton of olive oil. I use all kinds of stuff like that. And, if olive oil is all that good, why aren't we all using it? Why isn't it mandatory? Why isn't it the first line of go-to? I'll tell you why. Because it's cheap. It's very cheap. It's cheap. And because it's cheap, we got to sign off. And I want you to meet me on the live stream in just a couple of seconds. Remember, I do this every Sunday for one reason. I love you all. Let's go to the live stream and we'll continue the conversation.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Seeing Beyond the Surface with Thermography on Wednesday, September 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
you.